What up YouTube, Noble here, and I'm currently on my rheumatology elective rotation, where the most interesting thing for rheumatologists is when journal day comes out.
It's new journal day.
So in this video, I'll be talking about rheumatology, my thoughts on it after being on the rotation for about a month. So what is rheumatology? Rheumatology is a field of medicine that treats autoimmune and inflammatory processes that affects the joints, bones, tendons, ligaments, and muscles. Some of the most common pathologies that you're going to see in rheumatology is osteoarthritis, rheumatoid arthritis, your seronegative spondyloarthropathies, your vascularized diseases, lupus, gout, and even some inflammatory idiopathic myopathies. You're going to see a lot of cool things in rheumatology. I feel like a lot of things you learn in med school you don't see until you go to rheumatology, especially with physical exam findings. Like, I was able to see some really severe cases of psoriasis. You get to see kind of like the heliotrope rash and the gastropapules. So a lot of really cool, interesting pathologies that you get to see anywhere else in other fields of medicine. There are a lot of things to consider if you think that rheumatology is a field for you. One of the major things to consider is additional training. So rheumatology is a subspecialty of internal medicine and it requires 3 additional years after your IM residency. So in total, from med school until you're a rheumatologist, that's about 10 years of extra training. Another thing to consider is if you like fields of medicines that isn't just black and white. What I mean by that is that certain labs and tests doesn't always correlate to specific diagnosis. In rheumatology, you have a patient who comes in with like a positive rheumatoid factor who doesn't have rheumatoid arthritis. You have a patient who have all the signs of lupus and might not have lupus. So you have to really think abstractly about all these conditions to come up with your final diagnosis. So a third thing to consider whether you want to go to rheumatology is, and this is kind of a joke within the medical community, that you have to like touching patients.
I'll pay you $10 for every patient you diagnose without touching.
So in rheumatology, you have to definitely know your musculoskeletal anatomy and be comfortable touching patients. You know, you're going to be examining their hands, their feet, their back. So having good physical exam skills is really important to become a really good rheumatologist. A fourth thing to consider whether you want to rheumatology is, do you love immunology?
Yeah, they just discovered a new cytokine. Oh, what does it do? Same thing all cytokines do, confuse med students.
You're going to be working with a lot of medications, biologics that is very immunology focused, such as your TNF alpha inhibitors, your JAK inhibitors, IL-6, IL-23, all of this stuff. So having a really strong immunology background is essential for rheumatology. So the last thing to consider is whether you want more of an outpatient experience rather than an inpatient experience.
Well, welcome to rheumatology. We have a great mix of inpatient medicine, outpatient medicine, and waiting on hold with insurance companies to get prior authorization.
Rheumatology is mainly an outpatient experience. That means that you're in the clinics rather than a hospital. You are on call sometimes, but most of the times you don't really go into the hospital setting that often. So those are all the things you consider before deciding whether you want to go into rheumatology. There are so many great things about this field. One thing I really enjoy about rheumatology is that you definitely create close personal relationships with your patient. You're seeing your patients, every 3, 4, 6 months due to labs. My rheumatology preceptor, she has patients she's been seeing for over 10 years, and she knows them in and out. And so if you really value a field of medicine that has close personal relationships with patients, rheumatology might be the field for you. Another thing that I like about rheumatology is that there are so many complex disease and processes.
A very interesting patient who, Bill, there's a history of joint pain. Bill, I ordered an unnecessary ANA and now it's positive and I don't know what to do.
So you really value a field of medicine that makes you think abstractly, think critically, then rheumatology would definitely satisfy that desire. Finally, I think a unspoken thing about rheumatology is that there's such a high demand for it. It takes about 6 months for a new patient to see a rheumatologist. That's because there's such a short supply of them. So you really value job security, then rheumatology might be for you. Alright, so if there are no more questions, then thank you for watching.
I have a question.
Oh, I didn't know that there's someone actually here. What's your question?
So are you gonna go into rheumatology? Wow, that's a great question. I wasn't expecting that question.
Who's your daddy, Bill? Rheumatology's my daddy. Yes, it is.